Welcome students to our new YouTube channel Pharmatech, the division of excellence. So we start with the chapter NSAIDs. The next point is Eicosanoids. So let's start with this most important point for GPAT, Eicosanoids. So these are 20 carbon unsaturated fatty acids derivatives including prostaglandins, leukotrienes and thromboxanes. These all are inflammatory mediators. And the phospholipids from cell membranes mechanism is the phospholipids from cell membrane in that the corticosteroids increases the bradykinin and angiotensin, and the phospholipid from cell membrane forms phospholipase A2 and it gets arachidonic acid. So this arachidonic acid get divided into two parts, cyclooxygenase 1 and 2 and lipooxygenase. So these cyclooxygenase 1 and 2 the non-steroidal anti-inflammatory drugs inhibits, and this cyclooxygenase 1 and 2 forms prostaglandins, prostaglandins E2, prostaglandins I2, prostaglandins F2 and thrombox and thromboxane A2, and the lipooxygenase forms leukotrienes. Then next we see the prostaglandins and their types. The prostaglandins ligates is a subfamily of cell surface 7 transmembrane receptors, G protein coupled receptors. Then next we see the types of prostaglandins and receptors and also their function. So the first type is prostaglandin I2 and the receptor is IP, and the function of IP is vasodilation. It inhibits platelet aggregation and bronchodilation. And the second is EP1 and the function of EP1 is bronchoconstriction, gastrointestinal tract, smooth muscle contraction. And the third is EP2 and the function of EP2 receptor is bronchodilation, gastrointestinal tract, smooth muscle relaxation and vasodilation. Then the next type of prostaglandin is prostaglandin E2 and the receptor is EP2 and the function of EP2 is bronchodilation, gastrointestinal tract, smooth muscle relaxation and vasodilation. And the second is EP3 and the function of EP3 is gastric acid secretion and gastric mucus secretion and uterus contraction when pregnant and gastrointestinal tract smooth muscle contraction, lipolysis inhibition, autonomic neurotransmitters and platelet response to their agonist and atherothrombosis in vivo. So EP3 function is platelet response to their agonist and atherothrombosis in vivo. And the next is PGF2, that means prostaglandin F2 and the receptor is FP and the function of FP is uterus contraction and bronchoconstriction, and the second receptor is unspecified and the function of this receptor is hyperalgesia and pyrogenic. So the function of unspecified is hyperalgesia and pyrogenic. So next we see the prostaglandin antagonists. In that non-steroidal anti-inflammatory drugs inhibit cyclooxygenase 1 and 2. Corticosteroids inhibit phospholipase A2 production, and cyclooxygenase 2 selective inhibitors or COXIPs, and cyclopentanone prostaglandins may play a role in inhibiting inflammation. Then next we see the clinical uses of prostaglandins. In that we see the therapeutic abortion and prostaglandin E1 misoprostol with mifepristone, a progesterone antagonist. So the first therapeutic abortion is gastric cytoprotection. So gastric cytoprotection also called gastric ulcer, and the PGE1 and misoprostol. And the second therapeutic action is impotence, and the use is antagonist is PGE1 and alprostadil. And third is therapeutic abortion is maintenance of patent ductus arteriosus, and the use antagonists are PGE1 and alprostadil. And the last therapeutic abortion is pulmonary hypertension, and the antagonist use is prostaglandin I2, epoprostenol and flolan. And the agents and number of peptides in angiotensin 1 and calidin decapeptide, and angiotensin 2 there is octapeptide. And in oxytocin, vasopressin, that means they are antidiuretic hormone, ADH and bradykinin. Number of peptides are nonapeptides. So next we see the leukotrienes. Leukotrienes are fatty molecules of the immune system that contribute to inflammation in asthma and allergic rhinitis. Leukotriene antagonists are used to treat these diseases. The leukotrienes are naturally produced eicosanoids lipid mediators. Leukotrienes are produced in the body from arachidonic acid by the enzyme 5-lipoxygenase. And the examples of leukotrienes are leukotrienes A4, leukotrienes B4, leukotrienes C4, leukotrienes D4, leukotrienes E4 and leukotrienes F4, leukotrienes C4, leukotrienes D4 and leukotrienes E4 are often called cysteine leukotrienes due to the presence of the amino acid cysteine in their structure. Then next we see the function of leukotrienes. The leukotrienes act principally on a subfamily of G protein coupled receptors. They may also act upon peroxisome proliferator activated receptors. The leukotrienes are involved in asthmatic and allergic reactions and act to sustain inflammatory reactions. And the leukotrienes are very important agent in the inflammatory response. Some leukotrienes such as leukotrienes B4 have a chemotoactic effect on migrating neutrophils and as such help to bring the necessary cells to the tissue. Leukotrienes also have a powerful effect in bronchoconstriction and increases the vascular permeability. Then next we see the leukotrienes in asthma. So leukotrienes also used in asthma. So leukotrienes contribute to the pathophysiology of asthma, causing or potentiating the following symptoms. The symptoms are airflow obstruction, increased secretion of mucus, mucosal accumulation, bronchoconstriction and infiltration of inflammatory cells in the airway walls. So, and a leukotriene antagonist, sometimes referred to as a leukost. It is a drug that inhibits leukotrienes, which are fatty compounds produced by the immune system that causes the inflammation in asthma and bronchitis and constricts airways. And the leukotriene inhibitors or modifiers such as montelukast, zafirlukast and xylitol are used to treat those diseases. They are less effective than corticosteroids and thus less preferred in the treatment of asthma. These are two main approaches to block the actions of leukotrienes: the inhibition of the 5-lipoxygenase pathway. Drugs such as xylitol block 5-lipoxygenase, inhibiting the synthetic pathway of leukotriene metabolism. And the second is antagonism of cysteine leukotriene type 1 receptors. Montelukast and zafirlukast blocks the action of cysteine leukotrienes at the cysteine LT1 receptors on the target cells such as bronchial smooth muscles. Then next we see the platelet activating factor PAF. The platelet activating factor is a potent phospholipid activator and mediator of many leukocyte functions, including platelet aggregation, inflammation and anaphylaxis. And it is produced in response to specific stimuli by a variety of cell types, including neutrophil, basophil, platelets and endothelial cells. Like eicosanoids, it is not stored in the cells but synthesized after stimulation. Then next we see the chemistry. In chemistry it is its alkyl group is connected by an ether linkage at the carbon 1 C1 carbon to a 16 carbon chain. The acyl group at the C2 carbon is an acetate unit as opposed to a fatty acid whose short length increases the solubility of PAF, that means platelet activating factor, allowing it to function as a soluble signal messenger. The C3 has a phosphocholine head group just like standard phosphatidylcholine, that means standard phosphatidylcholine, and the functions are: it is an important mediator of bronchoconstriction. Second, it causes platelets to aggregate and blood vessels to dilate. Thus, it is important to the process of hemostasis. And the platelet activating factor antagonists zincolide B. The E drug actions on 5-hydroxytryptamine, that means serotonin 5-HT receptors. All serotonin receptors are G protein coupled receptors except to 5-HT3. The CAMP gives are 5-HT4, 5-HT6 and 5-HT7, and CAMP 5-HT1. IP3 DAG forms 5-HT2. Ligand gated ion channels are 5-HT3, and the 5-HTI A to G found in the central nervous system CNS, usually inhibitory, and smooth muscle in excitatory and inhibitory. Then next we see the buspirone. So it is partial agonist at 5-HT1A receptors, forms anxiolytic, that means generalized anxiety disorders GAD. And next 5-HT1D, in that the drug somatriptan agonist at 5-H1D receptor in cerebral vessel, it is used in migraine pain. So somatriptan is used in migraine pain, important for GPAT. So the adverse effect of tryptophan, possible asthenia, chest or throat pressure or pain. This is adverse effect of somatriptans. So next is 5-HT2, found in CNS excitatory in periphery activation, vasodilation, contraction of gastrointestinal and bronchial and uterine smooth muscle, and platelet aggregation. Then next we see the olanzapine. It is antagonist at 5-HT2A receptors in central nervous system, forms symptoms of psychosis and newer antipsychotics. Next we see the Cyproheptadine, the 5-HT2 antagonist used in carcinoid, other gastrointestinal tumors, and post-gastrectomy, also used for anorexia nervosa, has marked H1 blocking action. Then next we see the 5-HT3. It is found in area postrema, peripheral, sensory and enteric nervous. Activation opens ion channels. There is no second messenger. And the last one is ondansetron and cetrons. It is antagonists and they emesis in chemotherapy and radiation and postoperatively. And last is 5-HT4. It is found in gastrointestinal, smooth muscle and myenteric nervous. So 5-HT4 found in gastrointestinal smooth muscles and myenteric nervous. So some important notes in this topics. Key points about density. The cisapride receptor activator forms prokinetic in GERD, that means GERD, but a cardiac potassium channel blocker, that means K plus channel blocker forms arrhythmias, that means contraindicated in use. So next is allopurinol is a hypoxanthine analog drug which when used in the gout inhibits the xanthine oxidase enzyme and reduces the uric acid synthesis. So the allopurinol is the drug of choice in gout disease. Most important for GPAT when the drug of choice of gout is asked. So the answer of drug of choice for gout is allopurinol. So the next one is lithium carbonate and valproate and carbamazepine are the drugs used as antimanic drugs. So the lithium carbonate and valproate and carbamazepine are the antimanic drugs. And the last is buspirone is a drug used as an anxiolytic agent. So the buspirone is a drug used as anxiolytic agent, most important for GPAT. So here is the end of this chapter, non-steroidal anti-inflammatory drug. So in chapter we see the classification of non-steroidal anti-inflammatory drugs. After that, eicosanoids and the inflammatory disorders like drugs for cough and asthma and antitussives and prostaglandins and leukotrienes, and also the leukotrienes in asthma and various functions of agonist and antagonist like 5-HT1 and their types. So here is the end of this chapter NSA ideas. So hope you like this topic. So please, if you like this topic, please comment on comment section and please share this video more and more to your GPAT aspirants as well as CET aspirants. So these videos are more helpful for those students who are preparing for competitive exams. So please share this video more and more. Hope you like this video. Thanks for watching. Stay tuned for the next chapter, cardiovascular system. So in that cardiovascular system, the drugs used for cardiovascular system, the next chapter. So stay tuned for the next chapter, cardiovascular system drugs. So thanks for watching. Thank you. Stay tuned. Welcome students to our new YouTube channel Pharmatech, the division of excellence. So we start with the chapter NSA ideas. The next point is Eicosanoids.